Hi, my name's Dr. Chris Tan. I'm one of the specialist surgeons here at SASH.
Hi, I'm Dr. Emma Johnson and I'm one of the specialist anaesthetists here at SASH.
I'm Dr. Naomi Boyd. I'm the sports medicine veterinarian and physiotherapist here at SASH.
One of the most common causes of lameness in dogs is rupture of the cranial cruciate ligament. The current gold standard of treatment for this condition is a tibial plateau levelling osteotomy, otherwise known as a TPLO. The TPLO procedure is one of the most common procedures performed here at SASH. A TPLO procedure involves a wide team of specialists, including anaesthetists and rehabilitation specialists. There are two aspects to every TPLO procedure. First of all, the surgeon must inspect the joint to look for evidence of meniscal damage and confirm cranial cruciate ligament rupture. This could be performed as an open arthrotomy or through minimally invasive approaches like arthroscopy, which is performed here at SASH. Keyhole surgery means less morbidity to the patient while allowing the surgeon excellent magnification and illumination within the joint. Over recent years, there have been multiple publications showing the benefits of TPLO procedures. When measured objectively, we know the outcome of TPLO procedures are far superior to other techniques used to treat cranial cruciate ligament rupture in dogs. When your pet is ill or injured, it can be really stressful when they're presented to the vet and told that your pet requires surgery. Here at SASH, all surgeries involve a huge team of dedicated veterinarians and nurses.
I'm very lucky here at SASH to be a member of a team of 5 specialist anaesthetists. Having such a large team of specialist anaesthetists means that we are able to oversee all of the anaesthesia that happens here at SASH. This means that when your pet comes here for their TPLO, there'll be a dedicated specialist veterinary anaesthetist that will be overseeing your pet's procedure. As soon as your pet's admitted here in hospital for their TPLO procedure, one of my team and one of my dedicated nurses will assess the patient, assess any history or medications that's been on, and formulate a plan for the patient that day. We can appreciate that putting your pet through an anaesthetic can be a stressful time, and we want to provide the smoothest and most pain-free experience for your pet. As part of this, specialist veterinary anaesthetists are trained in many different types of local blocks that we can do for your animal to try to make it as pain-free an experience as possible. This would be similar to if you were going to have your own surgery at a human hospital. Whilst your pet is having their TPLO, we will continue to monitor them very closely throughout the entire anaesthetic. This monitoring continues in the recovery phase, when we also look to formulate a pain management plan for your pet to go home with. This could include both medication and physiotherapy and may include a referral to our rehab service.
One of the things I've always been proudest of working here at SASH is that all of our surgical patients receive a physiotherapy assessment and physiotherapy the day after surgery. We have established evidence in people showing how important getting moving after surgery is for getting people out of hospital, reducing the rates of complications, and ultimately getting better outcomes. In dogs, we're starting to see the same benefits coming through. In one study in particular, we saw that dogs were able to make significant improvements in their muscle mass in the limb that was operated on when physiotherapy and underwater treadmill sessions were part of their recovery. I'm so happy every day to be able to work with other specialists and be able to provide the care that gets these animals back to the things that they love most as soon as possible.
Ultimately, the aim of the TPLO procedure is to restore pain-free mobility to our patients. To get the best outcomes, it requires not just a great surgical team, but also an anaesthetic team to ensure that the procedure is as pain-free as possible, and then a rehab team to make sure we rebuild the muscle mass these patients require for pain-free mobility. So if your dog has been diagnosed with a cranial cruciate ligament rupture, feel free to reach out and contact one of us here at SASH because we're always happy to discuss this further with you.